Hi everybody, I've been getting a few questions about how to complete Docucare. So what I've done is I've pulled up a rubric and I can look at it on my screen and kind of guide you through it. And I've also got the Docucare pulled up. Specifically, I'm going to address the nursing diagnosis and a little bit of the how-to complete one for the maximum number of points. So when we begin creating a patient in Docucare, make sure you create the patient under the folder. Don't just automatically click add a patient. Open up the week that's available and then select create a new patient. This allows the instructor to be able to find your charting quickly and give you points accordingly. And whenever you create your patient, make sure you have the information needed to complete the demographic session. For instance, have the name, which you're going to enter the gender, make sure you know the religion, the advanced directive status, because all that has to be put in right up front. The ADLs, just chart exactly what you see there. When it comes to nursing diagnosis, and we have to identify a nursing diagnosis. This is a book that you have purchased. I have the one version behind you. I believe you have version 11, and the book is a different color. However, the same information can be found in both books. This is going to be your best friend. Please create a nursing diagnosis in Docucare. Don't use the pre-templated ones. You will not get credit if you use the templated ones. So just don't do it. Instructions say create your own, and this is the book that you need to create your own. So you get this book and you start looking at the very front. In fact, in the very front, it has a lot of medical diagnosis and it has associated nursing diagnosis under it. This is a really good place to start. For instance, let's say our patient has really bad incontinence. You see that they're in diapers or briefs, and what do I do for a patient who is in briefs? You look at the medical history, and the person has noted in their medical history that they have prostate cancer or benign prostatic hypertrophy. So what you do is you go to the first part of this book as just kind of a guide and flip through, and I've already kind of flipped through and I've looked under the B's and I find that benign prostatic hypertrophy. And let's say you didn't maybe know the medical diagnosis and you just know that they dribble urine. I could flip through and go to the D's. And here they have dribbling of urine, and it gives you the nursing diagnosis that you can use, and goals. It suggests goals for you to apply to a patient with this problem. So under dribbling of urine, I have overflow urinary incontinence and I have stress urinary incontinence. Both of them have the word incontinence highlighted. So that means I need to flip through to the I section to find the incontinence nursing diagnosis. You could also do urinary retention, health maintenance, readiness for enhanced knowledge. All of the nursing diagnoses associated with this medical diagnosis are suggested here. Now, that doesn't mean you can't do another nursing diagnosis outside of that. For instance, there's nothing here about self-image or self-identity. You can apply another nursing diagnosis. The front of this book are only suggestions. So that's something that you can take home about. But this is a good starting point. Point A. All right, so I would like to use a nursing diagnosis that has something to do with his incontinence problems. So there's a bolded word in the whole nursing diagnosis suggestion here. So I'm going to go to the part where it says risk for urge urinary incontinence, and incontinence is bolded. So I'm going to go to the I. So you go, and on your book it has these little tabs. Those are, A all the way, this is the index, A all the way through Z, and I'm going to go to the I's. And there's actually, when I open this up, if you're following along with me, multiple incontinence nursing diagnosis. There's functional. Hey, we studied that one, didn't we? There's reflux, there's stress, and there's urge incontinence. Well, which one do I pick? What's nice is this has a definition of what each nursing diagnosis entails, so you can pick the most appropriate one. Selecting the appropriate diagnosis is the worst part of all of this. The rest, it's just a piece of cake. Piece of cake. So, urge continence, involuntary passage of urine occurring soon after a strong sense of urgency to void. It's associated with overactive bladder syndrome. Our guy doesn't have overactive bladder. That's where you pee like 20 times a day. He actually just dribbles urine. So you know what? We're not going to use urge urinary incontinence. What may fit our purpose a little bit better is maybe the functional urinary incontinence. This is defined, as they have the definition listed out here. I'll show you. Right here, this says definition. This is where you read to see if it matches up well. Inability of usually continent person to reach toilet in time to avoid unintentional loss of urine. That works. He dribbles, can't get to the bathroom. So let's see, what do you do for a person? Well, when you go to create your nursing diagnosis in Docucare, that's where you first start. So your nursing diagnosis would be functional urinary incontinence, or it could be the other one, depending upon what fits your patient. All right, actually, let me look, because we have somebody who dribbles. Yeah, we'll go with this. All right, so type this into the nursing diagnosis box in Docucare. All right, diagnosis status. Usually you're not going to click resolved unless it's something that you fixed that day with somebody, such as they had stress, you spoke with them, and then now it's resolved. So you can leave that diagnosis status box unchecked. Diagnosis type. Usually if they are at risk for something, you could do the other option. I think there's actual, and then there's another one. I can't remember how it reads, but diagnosis type for our fictitious patient here would be actual. He dribbles. Then diagnosis category. If it's physiological, well, there's something wrong with the physical body. Psychological, it's all mental. It's all perception. All right. Now there's the next one that says related to. Where do I get this information from? I am just asking you to identify one related to factor, and if you look in your book, it actually lists out all of your options, and you pick the most appropriate one to your patient. Let me point this out. It says here, right there, related to. And I am only asking you to find one related to factor, and here it could be a cognitive disorder, neuromuscular limitations, impaired mobility or dexterity, environmental barriers to toileting. And let's see, his is, we're going to go with neuromuscular limitations. I wouldn't say his BPH, his functional urinary incontinence is related to BPH. That is an inappropriate way to write a nursing diagnosis. So I would say neuromuscular limitations. Period. Okay, then there is the section that says evidence by, and according to your rubric, you need 2 evidence by features. These can either be objective, something that you see, or subjective, something that the patient tells you. Where do I find this in the book? Well, this is listed as defining characteristics. So when we say evidence by, look in your book, and it's there. It's just labeled as defining characteristics. It's the same thing. So your options are able to completely empty bladder, amount of time required to reach the toilet exceeds length of time between sense of urging, sensing the urge to void, loss of urine before reaching the toilet, maybe incontinent only in the mornings. There's a lot of different options here. Or maybe the patient just tells you, I wet my pants. You can put that in quotes and put that in your evidence by section here. But combine what the patient tells you with the defining characteristics here, and this should be a no-brainer activity for you to complete this section, evidence by. Now, let's move on down to the independent and collaborative nursing interventions. If we flip the page, you see verbatim it says nursing interventions and rationales. Well, how do I know which ones are independent and how do I know which ones are collaborative? Actually, that's a great question, because the book tells you at the very bottom there is a little key that says a circle means independent, a triangle indicates collaborative, and there is no certain combination that I need you to report, such as 2 independent, 1 collaborative. Doesn't matter. If you do all independent interventions, that's fine. If you select all collaborative interventions, that's fine too. I just need 3 interventions from a book. Not from here, not we should turn, cough, and deep breathe every 2 hours. You're going to write exactly what you see from this book. If you're following along with me, the whole paragraph that follows the bullet or the triangle has 2 parts to it. There is a part that is in regular text, and there is a part that is in italicized text. The part that is regular is your intervention. That you would type in right into your intervention, and I want it verbatim. So, for instance, assess the client in an acute care or rehabilitation facility for risk factors for functional incontinence. That would be your entire intervention, that whole statement there. Not paraphrase, verbatim. And then the frequency. The frequency should never be PRN. There needs to be a start and a stop time, such as Q shift, or before discharge, or every day, or within 1 hour. So in this situation, assess the client in an acute care rehabilitation facility for risk factors for functional incontinence. I would say ×1. That is your frequency. Then the next little section says the rationale. This is a verbatim type of entry as well, and this is where you enter the italicized text, which for my demo here, it's a little bit lengthy, but that's okay. You would type it all in. Risk factors include dizziness, falls, impaired vision or hearing, amputation, decline in physical function, secondary to stroke, or other comorbid medical conditions that contribute to frailty, such as diabetes, arthritis, COPD, heart failure, venous insufficiency, Parkinson's disease, dementia, normal pressure, hydrocephalus, and depression. Put all of that in to the rationale, and then you're done. You're done with your interventions. Do 3 of those, and that's it. Then scroll on down on your Docucare, and you'll see the expected outcome, the patient will. According to your rubric, I'm asking you to identify 1 outcome. The book also spells this out for you. Here's all of my nursing interventions, and then here's the client outcomes. It says client outcome, and that says the client will. Don't make up one, use one from the book. That is the whole purpose of the book. Use the book. It has like 6 options here, 4, I can't count. Pick one, doesn't matter. It really doesn't. This is where you get to use your creativity to pick a standard outcome. Use portable urinary collection device or urine containment device when access to the toilet is not feasible. Put that entire thing, the patient will use portable urinary collection device or urine containment device when access to the toilet is not feasible, period. And then it says here a timeline, because we always need timelines on our outcomes and our interventions. And you could just say, during shift, and done. We do not ask for you to list a rationale for your nursing diagnosis. That is not according to your rubric. So save yourself the time, save me the time, and just leave that part blank. The very, very bottom, I would like you to list the reference. There's not a section for this, so just use the conclusion summary area to list your reference. Honestly, this is how I'd like you to list your reference. Say Ackley, Ladwig, or whatever your authors are. Nursing Diagnosis Handbook, page 452. Done. Your care plan should take you this amount of time. Use the book. It has actually sped up this whole charting Docucare process significantly for students who I've had to, kind of give them a one-on-one on how to. But your orders and your MAR, I'm just looking for you to tell me this is lisinopril. It is for blood pressure. For the ins and outs, this is something where, as a nurse, it is critical you get this information down. So at some point, points can be unnecessarily lost if you just don't chart. They had 204 milliliters of milk. Vital signs, and for your assessment for your head to toes, just chart what is italicized in your rubric to chart, such as the head, ears, eyes, nose, mouth, throat. We're not asking you to do the 6 fields of gaze, so don't make a narrative note, negative 6 fields of gaze, or tactile fremitus, negative, click, guys, just click it. Just click the box in the options there. Make it easy on yourself. The integumentary system, extremely easy. It's a, chart by exception. If their skin, say, is excessively fragile, or there is a wound or something like that, you need to go ahead and make a narrative note. But if it's all normal, just click that box and move on. Don't make excessive notes about how normal it is. We're good. Okay. And I do believe that is it. Your teacher is going to be giving you some feedback. If it is below our expectations, we will send it back to you and make you chart on it again. Save yourself the time, use the rubric, and you should be safe. You should be in the green zone. Let's keep it there. All right, everybody, if you have questions, send me an email. Have a great weekend.